Thank you. Thank you very much, Rajkot Society, for giving me opportunity to be on ultrasound workshop. Thanks a lot. These are my credentials. You can see my 113 research work over there. And this is not working. Okay. Recently, I got 2 seat of DTV diploma and ICOG fellowship. Those who want to come, and you can scan this QR code for all my publications. How beautifully everything is arranged by God. When baby is there, mother is ready to take care. With the blessings of mother of mine and so many mothers who have delivered a gynecologist, 3 books written by us. I must thank Rajkot Society for giving me the writing hand by Dr. Sudhir Shah, and 3 books written by us is recommended in Royal College as a reading material. Atlas Optical Echocardiography and Technique of IVF Medicine has also gone for 2nd edition, and I'm editor in chief of 2 journals, that is Indian Journal of Obstetrics and Gynecology. This is a Scopus recognized journal, so those who want to publish their work, they can contact me anytime. Work as a KOL in diabetes score, and recently I got opportunity to take interview of Professor Dharman Tunde in Ashford 2023 at Calcutta. USG in genetic tuberculosis. Question asked, when process? This is a dilemmatic situation. That's why I contacted Sonal ma'am. Can give me some pictures that I can put in my presentation. Let's go from the serious stage when you have to suspect it. Okay. Yes. You can see. Can you give pointer if it is possible? Okay, thank you. You can see this is ultrasound of serial pyometra. Patient is came with secondary infertility, has got all the features of tuberculosis. You can see there are 2 big pouches over there. Madam has already rightly told us C4 vascularity, C4, 2 beautiful pouches of pyosalpinx. And remember, when you want to suspect tuberculosis, it is always bilateral pyosalpinx or bilateral hydrosalpinx. It is the primary condition of tuberculosis. You have got 3D facilities, so you can do 3D of liver, 3D of ovary, you can have everything, and you can see that there are 2 beautiful pouches of pyosalpinx are there. Again, I am saying that when you want to suspect tuberculosis or pyometra, you can see there are 2 beautiful hydrosalpinx pouch or pyosalpinx pouches there, and uterus is lying in between. Yeah, thank you so kindly. So you can see uterus is lying over here, and there are big pyometrial pouches are there. You can have a clinical experiment and always see the ovaries between the uterus and great vessels. But when there is a hydrosalpinx or pyosalpinx, ovary moves little bit outwards, but still it remains above the boundary of great vessels. Ovary doesn't go beyond the great vessels unless and until it is torsion wall. You can measure it is a very big pyosalpinx, 8 by 8 centimeter. And only thing, because I am a laparoscopic surgeon also, only thing, all solution of pollution is dilution. Go for laparoscopy, remove all the tubes, see the case of secondary infertility, give them the option of IVF after treating her tuberculosis. Let's say, thank you Sonal madam for this gift. Yes, yeah, thank you. Love you. So you can see this is endometritis. Every organ in genital tuberculosis, every organ means uterus, tubes, ovaries, nearby adnexa, peritoneum, frozen pelvis, everything will be involved in tuberculosis. You can have a very good vascularity, endometrium vascularity will be very there, and you can have a central echogenic things. Endometritis, this time from Dr. B.I. Patel, that this is very good vascularity is there. You can see in 2D echo, 2D ultrasound, you can see only endometrium. But color adds in your life. Now everybody has got color doctor. So whenever you are in doubt, just put your color, but color should be of low PRA, because these are very low loading vessels. So with high PRA, you don't see this much of vascularity. You can see this vascularity, and virtually 3D ultrasound has replaced hysteroscopy. Once you see this type of indentation going into the tube, it says that tube has got something inside. Madam has defined tube very well, and madam can say that you can see the tube if it is only pathological. Normal tube you can't see on ultrasound because it is a hollow structure. But in tuberculosis, you can have all variety of tubal anomalies, ranging from tuberculosis pouch, vidate, rosette, every anomaly, every beaded appearance, every type of tubes anomaly you can see with tuberculosis. And when you see this type of things, suspect tuberculosis. Calcified endometrium. Sometimes you see small calcified spot. Unless and until she has got history of second trimester abortion, maybe a bone, but if it is not, she is coming for infertility. And when you see this hypoechoic calcified structure in calcified endometrium, think of tuberculosis. Enlarged uterus with pyometra. These all are pyometral sections. Why uterus doesn't have facility to have a necklace? Only women can wear the bilindi and big diamonds. Uteruses also have this type of things. Once you see this type of diamond appearance with so many septas, think and suspect of tuberculosis. Once we say pyometra, we have to say atrophied endometrium also. This is the atrophic endometrium. When I started 3D ultrasound in 2005, I see that if there is atrophy, why there is a big endometrium like this? Believe me, this is a coronal section. You can see the base of your farm. This is the base. It doesn't mean that it gives you thickness. Never measure endometrial thickness from year to year because there are 3D structure. You are watching from above, so it is just your base of the endometrium. You can see atrophic endometrium like this, suspect tuberculosis. You can have an endometrial collection like this, very bad endometrium, fluffy with patches, suspect tuberculosis. I said hydrosalpinx. Whenever genital tuberculosis is there, bilateral hydrosalpinx is usually present with this many of septa. Unilateral hydrosalpinx also can be there in early genital tuberculosis, but usually it is bilateral. If tube is pathological, it is easy to find on ultrasound because this is very rigid tube with collection. You can have a different tobacco pouch. You can have a beaded appearance of tube like this in hydrosalpinx. Suspect tuberculosis. You can have all different variety of tubal hydrosalpinx. Tobacco pouch, double pouch, beaded tube. This is a popper-like tube. Everything of tubal anomaly you can see. Once you see this type of things, suspect tuberculosis. There is a fluid in cul-de-sac with so many necklace-like pattern with different uterus. These all are septas. Suspect tuberculosis. Loculated ascites. Patient has got no complaint of ascites, but there is a loculation. All these type of loculations are there. Suspect tuberculosis. Loculated ascites, uterus is lying over here. So many septa with free fluid, with history of weight loss, evening rise of fever, scanty periods or heavy periods, and infertility. Suspect tuberculosis. Same loculated ascites with near to the bowel with calcified spot. Suspect tuberculosis. Tuberculosis with copper. Since I have got one patient of tuberculosis of cervix, I usually tell my patient, all my residents, because I have a legacy of living in my place, I have 53 residents already passed. It is a humble request that whenever you put copper T, try to cut the thread flush to the cervix, because this thread is very much easy carrier for all bacterial infection, tuberculosis infection, putting into the bladder. We have got one patient of tuberculosis cervix in action. Since so many, just we see very big erosion, we tried with normal antimicrobials and vaginal dressings. Even after 2 doses, she doesn't have any improvement. So she asked why it is there. Then you have to remember the Prabhu Isamasi. Give how years. Listen them carefully. What is the history? Anybody knows what is the definition of history? History is study of past in light of presence to have good future. So all our patient says that is in the past. Just with history, we know that the husband has got tuberculosis. They are using saliva as a lubrication, and that caused tuberculosis of cervix, and she was very happy after the 3-month packaging. Otherwise, red, angry looking cervix, we all know this is a cervical erosion and we are treating with normal antimicrobials. But whenever you see this type of cervix without improvement with your microbiomes, think of tuberculosis. When you think of tuberculosis with men, as we got ultrasound legacy, just see the male testes also. See, he is also taking part in infertility. ecogenic or hypervascularity in the testis, suspect tuberculosis in male also. Then comes administrative structure, that is ovarian cyst. This ovarian free fluid, septate-like structure within the ovaries, suspect tuberculosis. Typical cyst with hydrosalpinx. Patient has got thick calcified endometrium with ovarian cyst, not responding to your ovulogens, not responding to your estrogen well rate when we are giving from to increase the endometrium. Think of tuberculosis. You can see hypervascularity in the tubes with free fluid. Think of tuberculosis. Same Sonal madam has again given in this picture with free fluid collection with hypervascularity with fluid collection. Think of tuberculosis. I must thank Dr. B.I. Patel for giving these slides of osseous dysplasia. When you see this type of dysplastic things, think that the patient has got removal of fibroid, because you can see barb suture has got the same ecogenic ring. So if somebody has sutured endometrium with barb, open the endometrium and taken the single stitch, it also look like this. Septum was resected or large polyp removed. If it is not, then you can see this osseous dysplasia. Think of tuberculosis. Always take help of 3D. Here you don't see any osseous dysplasia, but there is a one spot here, there is a one spot here, there is a one spot here, and irregular cavity showing hyperechoic areas and puckering. Think of tuberculosis. Same osseous dysplasia. These all are calcified spots. You can very well see on this 3D ultrasound. Maybe one or two or maybe single. This is usually calcified degenerative spot in tuberculosis or recurrent implantation failure, recurrent BAE. Think of tuberculosis. Now we have 6 minutes left. So we have got something regarding the incidence and some pathology. I have to just take care of your Robin second MBBS because somebody might have forgotten because it is a long way apart. But recently if you see that genital tuberculosis in India has increased to 30%. From 2015 to 2021. We all know this is because of tuberculosis organism, non-motile, non-capsulated, acid fast. We all know the pathology, but usually each group has got nova. Primary infection occur close to the menarche. And it is about 3 times. Myobacterial tuberculosis, bovine, almost secondary time. Usually fallopian tubes are the primary sites. Spread will be hematogenous, lymphatic, direct, just from saliva, or ascending, usually occurs in 100% of the tubes. Same way, baby wants to implant themselves in the garden of Pancula. We all know that life is like a race. Womb is resting in the garden of Pancula. So many sperms are going to meet that beautiful sperms. Same like ampulla, hardware tuberculosis, sprays medially to the muscular layer, causes perisalpingitis and salpingitis is the mechanodosa. If it spread outwards, there is a fibrosis, segmental thickening, something like tobacco pouch appearance and tubo-ovarian mass. Different type of tuberculosis, we all know exudative and productive adenylolysis. If you see the tuberculosis endometrium, usually it starts with the basal layer, shed with each menstruation. That's why best way to get the TB PCR done at the time of menstruation. Reinfection in the scrotum can be endometrial ulceration and there will be ascerment. Uterus is always there with the myometrium, caseation and parametrium. Tuberculosis ovary can cause by periophoritis or ophoritis. Tuberculosis cervix, I know that it may be from direct causes or it may be from the sexual partner causes. It usually ulcerative, most common, may go for papillomatous and biliary. Peritonitis has got serous variety and plastic variety. Serous variety is most common. We can have a tuberculosis of vulva and vagina, very rare, but it is there. Vagina may simulate carcinoma and vulva has got small ulcer and good for ulceration. Tuberculosis of pelvis, we can have to differentiate from genital tuberculosis. Always suspect tuberculosis when patient is present with clinical symptom. Usually they are asymptomatic with history of poor health, infertility, abdominal swelling, menstrual disturbances, postcoital bleeding, and vaginal discharge with dyspareunia. Usually most common symptoms is infertility with lower abdominal pain. Second common symptoms are pain. How many of you had heard that our patient says, whenever I got periods, my abdomen just got swell. Masik wakte maru pet khuli jai. Usually we ignore that symptom. Am I right? એવું તો થાય કે કોઈ જોયું નથી. But when I studied tuberculosis, menstruation associated with swelling of abdomen can be a part of genetic tuberculosis. So whenever patient complains like this, suspect tuberculosis. Patient has got menstrual complaint, amenorrhea, with history of primary infertility, low vaginal pain. There are so many signs. All the masses you can feel in the upper vaginal examination, sometimes ascites. Diagnostic criteria, most common clinical suspicion. It should be scanned with laboratory evidence, histopathological, imaging with ultrasound, and if needed, go for laparoscopy. Clinical suspicion, whenever there is unexplained infertility with any duration, with previous history of tuberculosis or patient with migration from high prevalence area, incidence if he is residing in high prevalence area, low socio-economic background, and most commonly in young girls, don't think that they are not taking drugs. Drugs are now easily available each and every corner of Gujarat, and smoking is very common amongst the young girls and HIV positive states. Generalized symptom, loss of appetite, low-grade fever, night sweat, persistent vaginal discharge with adnexal mass. Go for routine investigation. Most common is QTGPs and serology with AFP, ultrasound. Hemogram is usually normal, ESR may not be elevated, but always CA125 is elevated. X-ray test has got typical findings of tuberculosis. Always go for endometrial biopsy. It is positive in 50 to 60% of cases. And on microscopic appearance, you can see granuloma, multinucleated giant cell, Langerhans cell, epithelial cell, and necrosis. Positive HP indicates 100% of TB, salpingitis. Go for culture. It is a conventional culture, either egg-based, agar-based. Most important is MGIT, more evidence sensitive for other methods. Smear microbiology, gel cell, higher sensitivity with fluorine. Tuberculin, Montauk states, we all know 10 testing, skin test should be done. Ultrasonography, we have discussed at a large, but you can see HSG. When there is no active infection, you can have all different varieties of tubes like tuberculosis, leopard skin, rosette, motican, sperm head, beaded, distal tube distortion, coiling, bilateral corporal block, irregularity and honeycomb appearance of the uterine cavity. These all are the different methods of tubes are there. We don't want to go for this. Every filling defect, motican, hysteroscopy is standard. You can go for laparoscopy. Serological test based on recognition of the host, and age 60 and 38 kilo data are usually purified age tested. PCR, molecular biology, DNA probes are there. You can detect very well. Results will be available in 2 to 3 days. DNA probes are also available with DNA microarrays to diagnose tuberculosis. These all are biochemical markers, adenosine diamidase activity tested in associated level of less than 30 with acidic flow significance. Tuberculostatic acid test, that is fatty acid present in mycobacterium only. Man need is difficulty. This is just I'm finishing. This is last slide. I don't never take more than 20 minutes. These are my GIF on all diaprogesteron. Yoga always speaks. So there are little GIFs out there, and just give me the audio. So at the end we should be happy. Just start. No audio. I already told you how to put audio inside. Okay, the time to be happy is now, so everybody should be happy. At this juncture, we have to get happy ourselves.